My name is Julie Johnston, and I'm here in my wonderful practice in downtown Denver, Colorado. I'd like to talk to you today about the Philips Sonicare AirFloss machine. I was part of a study a while back and got to choose two patients, one male, one female, that, well, let's put it bluntly, never flossed. Didn't like to floss, didn't want to floss. And so these were the people I picked for the study. They were each given one of these wonderful little machines, the AirFloss, and sent them home. Didn't give them any special instructions, but before I sent them home, I checked them off very thoroughly and went through and measured all of the bleeding points. Both of them happened to have lower permanent orthodontic arch wires. You can imagine what their tissue was like, pretty bad. Lots of bleeding points around this area, people that didn't floss. So they came back a month later, and I have to tell you, I was just amazed. I've been in the dental business for a long time, and I'm very skeptical anytime anything new comes along. I like to see things with my own eyes, and I was amazed at the difference in their mouths. Their bleeding points practically non-existent. The areas where the lower arch wires were, the tissue was firm, pink, healthy, lovely, and I tell you, I was sold on it right then. And another thing that I particularly liked about the AirFloss was the fact that they found it easy to use. They liked using it. The compliance was phenomenal. Plus the fact they too knew that they were in the study, and so I thought, well, maybe after the study is over they'll stop using it or compliance will fall off. Well, I want to tell you, I was very pleased. They came back again, 6 months later, and it was like, wow, they're still using it every day. They still love it. Their tissue is still fabulous and healthy. As I said, I am really sold on the product. In fact, I'd show you one today, except our office is sold out of them. We really like them up here. We find that they're particularly useful in people that have any sort of orthodontic appliances, plus the fact also we all have these people that just don't like to floss. They don't like their fingers in their mouths. Some people have different manual dexterity issues, and I find that this AirFloss is perfect for these individuals. Also, too, anybody that is older, they absolutely love them because it is so simple and easy to use, and they feel like they're really getting back there in those little back molars. All in all, you can tell that I think the AirFloss by Sonicare is one of the best new inventions that's come around in a long, long time. As hygienists, we all have these patients that just don't like to floss. We want them to floss. We all know the benefits of this. So when we're talking with them and we go over our flossing techniques and everything else, we can more or less tell the people that are going to floss for you and the people that are not. These people that we think aren't going to floss, perfect time to introduce the Philips Sonicare AirFloss because it is an alternative for them. It gives them a choice. It makes it so that they can end up doing something to help their own oral health. And we don't have to nag them all the time and say, oh, haven't flossed again, This way they can say, oh yeah, I love this machine. And I know they will, because that's just exactly the results that I've had from everybody that has ever tried it. And I love the results of their tissue when they do use it. Just wonderful.